Hello everyone, welcome back to the Medico Experts channel. Today, we're going to talk about 10 things to know about cerebral palsy. So let's begin, friends. Cerebral palsy, CP, is a group of disorders that affect movement and muscle tone or posture. It's caused by damage that occurs to the immature, developing brain, most often before birth. Here are 10 facts about this cerebral palsy. First, cerebral palsy is not a disease. It is a term that describes a range of neurological problems that affect movement and coordination. It is not contagious, progressive, or curable. Second, cerebral palsy can have different causes. Some of the possible causes include: Part 1. Brain damage during infancy. Part 2. Preterm birth. Part 3. Being a twin. Part 4. Certain infections during pregnancy. Part 5. A difficult delivery. Part 6. Head trauma during the first few years of life. Third, cerebral palsy can have different types and symptoms. The type of cerebral palsy is determined by the main movement disorder experienced, but several movement disorders can occur together. The most common type of cerebral palsy is spastic cerebral palsy, which includes stiff muscles and exaggerated reflexes. Other types include dyskinetic cerebral palsy, which involves involuntary movements, ataxic cerebral palsy, which affects balance and coordination, and mixed cerebral palsy, which combines features of different types. Symptoms can vary from person to person and over time, but may include poor coordination, stiff or loose muscles, weak muscles, tremors, difficulty with speech and eating, learning difficulties, intellectual disabilities, seizures, vision and hearing problems, and bladder and bowel problems. Fourth, cerebral palsy can be diagnosed based on the child's development. There is no specific test for cerebral palsy, but doctors can diagnose it by observing the child's motor skills, muscle tone, reflexes, and posture. Diagnosis usually happens by first or second year of birth, but some cases may be detected earlier or later. Blood tests and medical imaging may be used to rule out other possible causes or to identify the extent of brain damage. Fifth, cerebral palsy can be treated with various therapies and interventions. Treatments of cerebral palsy can help improve function and quality of life. Treatments may include physical therapy, occupational therapy, speech therapy, conductive education, external braces, orthopedic surgery, medications, and alternative therapies such as acupuncture or massage. Advanced treatment like stem cell therapy is giving very promising outcomes. To know more about stem cell therapy, please check the link in the description section. 6. Cerebral palsy can affect people differently throughout their lives. Some people with cerebral palsy may have mild symptoms that do not interfere much with their daily activities, while others may have severe impairments that require constant care and support. Some people may experience improvement or deterioration in their condition over time due to aging or other factors. Some people may face challenges such as pain, fatigue, depression, or social isolation due to their condition. Some people may also have other health problems or complications related to their condition such as osteoporosis or scoliosis. 7. Cerebral palsy can be prevented in some cases. Some of the risk factors for cerebral palsy can be reduced or avoided by taking preventive measures such as: Part 1. Immunizing the mother against certain infections during pregnancy. Part 2. Ensuring adequate prenatal care. Part 3. Avoiding exposure to toxins such as alcohol or drugs during pregnancy. Part 4. Monitoring the baby's growth and development during pregnancy. Part 5. Delivering the baby in a safe and timely manner. Part 6. Providing proper care for the newborn. Part 7. Preventing head injuries in children through improved safety measures such as using car seats or helmets. 8. Cerebral palsy is not rare. According to the World Health Organization, WHO, about 17 million people worldwide have cerebral palsy. It is one of the most common causes of physical disability in children. The prevalence of cerebral palsy varies across regions and countries depending on the availability of healthcare services and resources. In developed countries, the prevalence is estimated to be around 2 per 1,000 live births. In developing countries, it may be as high as 15 per 1,000 live births. 9th. Cerebral palsy is not a barrier to success. Many people with cerebral palsy have achieved remarkable accomplishments in various fields such as arts, sports, science, politics, and activism. Some famous examples include 1. Painter Frida Kahlo. 2. Musician Stevie Wonder. 3. Comedian Josh Blue. 4. Physicist Stephen Hawking. 5. Actress Jerry Jewell. 6. Activist Helen Keller. 10th. Cerebral palsy is not a reason to lose hope. People with cerebral palsy can live fulfilling and meaningful lives with the support of their families, friends, communities, and professionals. They can also contribute to society in many ways and advocate for their rights and inclusion. People with cerebral palsy can have dreams and aspirations, and they can pursue them with determination and resilience. Conclusion. Cerebral palsy is a complex and diverse condition that affects movement and muscle tone or posture. It is caused by damage to the developing brain, most often before birth. It can have different types, symptoms, causes, treatments, and outcomes. It can pose many challenges, but it can also be a source of strength and inspiration. People with cerebral palsy deserve respect, dignity, and support to live their best lives. Thank you for watching. Don't forget to like and subscribe to our channel for more informative videos on health and wellness.